A tooth is a very common thing, but it is most marvelously engineered. Do you know that a tooth is set in a socket that if you should happen to injure that tooth or get it loose, we can, if it isn't separated already from its nerve, we can just push it back up into the socket. And then if we will not chew on it for a while, it will actually grow back into its place and be just a nice normal tooth. So we can always hope, if we have a loosened tooth, that it doesn't get broken from its nerve. The tooth has the nerve on the interior, then on the outside of that there is another casing, and then out on the outside there's another casing called enamel. This is the white part of the tooth, the part that shows, and the part that we hope is white. That makes us have a very nice, beautiful smile, having white teeth. I'm so glad the Lord didn't make us with black teeth or purple teeth, even blue teeth. I'm not too sorry to have blue eyes, but I wouldn't want blue teeth. I think the Lord knew just how to make us in an artistically designed whole so that we would look very pleasing. I think human beings look very nice. Now, in addition to the tooth and its socket, we have gums. And gums are also a very nice part of the smile, but gums can sometimes get afflicted. And Don Miller, who is a lifestyle counselor at Uchee Pines, is going to talk with you about some of these things having to do with the mouth, and I can guess from what I see in your hand that you're going to be talking about the throat as well.
I am going to do that.
Tell us what you have for us.
Okay, you know, the teeth are so very important. As a matter of fact, they've sort of related or correlated people growing old sooner with the lack of teeth. As we get older, we lose our teeth, we don't chew our food as well, and we seem to get older a little bit sooner, it seems. So we need to take good care of these teeth. I've known many people in their 80s and the 90s and even in their 100s with all of their teeth still intact because they've taken good care of their teeth. Dr. Thrash mentioned the gums. We can get an inflammation, a bleeding of the gums, and even a receding of the gums. When we start seeing that particular problem, we realize that if we don't arrest it there, it's going to get a whole lot worse later into something called periodontal gum disease. And so what we want to do is take care of our gums and our teeth. Some simple things. One, and our mothers hopefully have been telling us this all of our lives, take good care of your teeth. Brush your teeth every day. Now, there's some important points about brushing your teeth. I know that years ago, when I first went into the military, they taught us how to brush our teeth. And basically, you took that toothbrush and you put that thing in your fist and you stuck that thing back in your head and you went back and forth and you scrubbed and you scrubbed and you scrubbed. And I was good at taking orders, and so I scrubbed and I scrubbed and I scrubbed until I pretty much wore the enamel away from the place on the top of my teeth just where it gets into the gums. Now I have that particular problem. But we should do more of a sweeping motion. I've brought my toothbrush with me today, and I have a couple of recommendations about your toothbrush. I'm not going to recommend a brand or a shape or a color, but I do recommend soft bristles. And if you have sensitive teeth, you have this problem, and you're getting ready to brush your teeth, I suggest you take your toothbrush and you soak the bristles in hot water, which will soften them up just a little bit more before you brush your teeth. Now, okay, if it's hot water, it's going to make them soft. Boiling water will make them softer. So I once did that. I put them in boiling water. Don't do that. It looks like your toothbrush is having a bad hair day.
Yes, I believe that one may have had a bad hair day. It looks as if it's flattened out there.
But see, I've had this toothbrush a long time, and we shouldn't do that. When they start looking like this thing, we need to get a new toothbrush.
A new toothbrush.
So I need to remind me to get a new toothbrush, but I'm sort of fond of this. As a matter of fact, they've got these new things. They're colored at the end. When the color fades away, it means it's time to replace the toothbrush. It's a good marketing thing, if nothing else. But we should brush our teeth down with the grain of the tooth. Put the edge of the toothbrush up near the gums, do a little sweeping motion, a little back and forth motion to get up underneath the gums, and then sweep down. And we don't stop there. It's good then to do some dental flossing. People have a lot of bad breath. And I have found a real good way to determine whether you have bad breath or not, because you can do this all day. No, it smells great. Well, all you're smelling is your hand. You're not smelling your breath. But if you take something like they have these little toothpicks with brushes. It's called a I forget what it's called, something like a toothbrush, but it's a little toothpick thing with a little brushy end on the end. Stick that between your teeth, twirl it once, bring it out, and smell it. That's what your breath smells like. I'm sure you'll stand closer to your toothpaste next time you brush your teeth. But we need to keep our teeth clean inside and all around them. We also need to keep our mouths well hydrated. We have to realize that our teeth, even our teeth, about 10% fluid content, which means that there is some fluid inside in the pulp of our teeth. If we are not drinking enough water, eating a lot of sweets or fat, we are clogging up this very minute capillary system. Therefore, we're closing off the nutrient pipeline to the tooth. And if we do that, we're going to start having a weakened tooth. And when we weaken the tooth, it is now open for assault from an outside invader. The plaque building up because we don't brush properly, the tooth itself becoming weak because we're drinking 2 cups of water a day and eating gummy bears all day. We need to find a way to keep our teeth healthy inside and out. So we do something simple like that. But if you already have the bleeding of the gums, there's a few things you can do. One, you should rinse your mouth out quite often. You can even, if you have a water pick, that's fine. Use your water pick in between your teeth and up around the gums. And then you might want to take a little bit of golden seal herb. Now it's bitter as all get out, but it's a very nice herb. You put a little bit on your moistened finger and massage it up into your gums. You can also use baking soda. Massage that up into your gums, but then I would recommend after that you rinse your mouth and you spit it out because you don't want the baking soda inside your body. You want it basically helping with this particular problem with your teeth. So, and then you have to increase your diet with raw foods and good fruits, vegetables, whole grains, nuts, and seeds. This is a diet that's made for us to keep our bodies healthy. And I want to recommend to you mothers and even to you young children who are listening, who really say, I want to present my teeth, even my teeth, living sacrifices to the Lord. We find that if a child is not introduced to refined carbohydrates in the form of sugar before they're 11 years of age, often they never have to face carious teeth in their whole lives and all the other problems that go along with it. So let's say you have the first one, you've got the bleeding gums and you do not take care of it. Your next step is pyorrhea, which basically is that infection has gone down to the tooth socket, right down to the bone. Now we're in serious situations, and many times I'm afraid that the treatment of choice is to take all the teeth out. But if you can get it before the teeth start getting loose in their sockets, I recommend large doses of charcoal. I've had people mix up a paste of charcoal, put it on their toothbrush, get it all on their toothbrush, go up there and they pack it between their teeth, up around their gums, all in their mouth at nighttime, and then they leave it there all night long. The charcoal will be absorbing the infection, will be helping with the inflammation, and I have seen when the teeth are just barely getting started being loosened, the whole process reverse. And so you put a lot of charcoal in your mouth. I would go then also with the golden seal. I would go with the baking soda and hydrogen peroxide massaged into the teeth, all around the teeth. Of course, rinse your mouth out afterwards. Flossing your teeth. Flossing the teeth, you'll find the first few times, if you're not used to flossing, the first few times you floss, you're going to get blood. But the more you do that, you sort of toughen up the gums, you toughen up the teeth, and that very toughening action is going to help you avoid your appointment. And many of us have appointments with periodontal gum disease just because of the fact that we're not practicing good oral hygiene. So let's say we've taken care of the gum problems. We're brushing our teeth well, we're eating good food, we're staying away from refined carbohydrates, we're staying away from free fats, and so we've got a good circulatory system. The Bible says the life is in the blood. We've got good life, but for some reason we've gotten in a way of a germ, a virus or something. We've gotten a sore throat. What can we do for a sore throat? Some very simple things. One, we can gargle with salt water or just warm water. Warm water will help. Salt water just a little bit better. What I like to do if I have a sore throat is I'll take a charcoal tablet. I'll take usually 2 to 4 of them at nighttime before I go to bed. I'll put them back between my cheek and my gums, just sort of stick them down in there and working down there real good. They're not going to jump down your throat. They're not going to fall out on your pillow. They'll just stay there all night long. But as you sleep and you're salivating the whole night long, you're going to be putting a small trickle of charcoal down your throat, and that itself will take up inflammation. You can also do something that we like to call a horse collar. If you're hoarse or you've got a sore throat, you can take something as simple as a horse collar, which is a piece of, this is nothing more than a piece of felt. It's made quite nicely. Our students made a number of these at UT Pines a few years ago. We put these in cold water and then wring it out and then wrap this horse collar around your neck. And then once it's around your neck, you take a heavier piece of material. Now this one's been made very nice with Velcro. We put that around the neck on top of the wet felt, and it will hold it in place. We do that overnight. This is bringing, it started off cold, but immediately it starts bringing heat into the area, which is going to fight the infection. It's going to bring heat, it's going to bring nutrients, it's going to bring oxygen, it's going to bring all the things that we need, and I have found many times that this simple treatment alone will shortstop a sore throat. So let's say you've got the sore throat first thing in the morning. You don't want to walk around with this thing around your neck. Well, get yourself a turtleneck sweater, put the turtleneck sweater on in place of this outside one, and put this underneath, and you'll be fighting a sore throat all day long and no